There's always a question: should you take a daily multivitamin or not? Are you wasting your money? Or you're selling out to marketing, or does it really help? Lisa Breck, what do you got there?
Well, I'm here with Dr. Ahluwalia, of course, and there's been this 11-year study to show what multivitamins can or can't do, and this study actually had some surprising results. But Steve, it has to be for older guys, not older guys, but guys over 50.
I'm listening. I'm listening. What do you have for me? Okay.
Yeah. So it actually can help reduce cancer, right?
Yeah, exactly. So, you know, Lisa, we're a little surprised because so far we have said multivitamins, there's no evidence to show that they do anything with cancer in general. But this study was well done. It was doctors above 50. They either gave them a placebo or they gave them a multivitamin.
And they gave them a specific one, which was Centrum Silver,
correct.
right? Okay.
But you know, we don't think that the actual manufacturers interfered with the methods and materials. It was just that they provided the vitamins.
Okay.
And what they found was that there is a benefit, although small, of taking multivitamins in men.
But not so good for women, though.
There was a study last year that showed that women actually had a higher incidence of death from cancer or other problems if they took this multivitamin. So I think what we have to say is that everything we do is related to a body of evidence. This is the first kind of salvo that perhaps this helps in men. I think we need other studies to replicate this, to prove to us that that's true. I think it's hard to tell our viewers what to do and what not to do just based on this. But I think if you're a man, an older man, above 50, then I think that taking a multivitamin is not a bad thing. I think in general, our advice is eat healthy, nutritious food.
Get the food you need.
Right, exactly.
Now, this next one, so many people have struggled with infertility over the years, and now there's some signs that there may be a real downside if you go through IVF, say.
Right. So we've sort of known this for a little bit, that there's a small risk of having birth defects with IVF. Okay.
That's when they take the egg out and fertilize it in a lab and then put it back into the female.
Correct, exactly.
Okay.
So there's multiple technologies that they utilize. But I think the thing to remember is that it is of a small risk. And it's just something that you need to discuss with your doctor before you have the IVF. But what is the choice? Not have a baby? You know, I mean, these are older infertile women, and perhaps the infertility itself is leading to an issue that may be causing this problem.
And what type of birth defects are we talking about?
You know, all kinds. Okay. Eyes, heart, you know, we just look at everything and try to quantify that.
And this is only IVF. This doesn't have anything to do with, say, any type of drugs that you might take to stimulate pregnancy?
Well, IVF, by definition, most of the time involves the drugs to get your eggs to, you know, be produced and to make it more likely that you would conceive. Okay. So we don't know which part of it is causing the problem. I think we need to flesh it out a little bit more.
Okay. And again, always talk with your doctor about the risks.
Always, always.
Okay, Dr. Ahluwalia, thanks so much, and we'll see you again next week. Steve?
Thank you so much. I feel so much healthier after this segment always. Thank you so much.